as well as active and healthy aging. And I'm here today together with many partners of this project, and in particular with my colleagues, Sara Beccati and Marianna, because we would like to share our project ideas and objectives with all of you. And we thank you for your participation in this first webinar. Before going to the details, I would like to remind you that this webinar, as you saw, will be recorded. So if you don't want to appear in the recording, you can switch off now the camera. We organized this webinar to start discussing with you what are the skills, the knowledge, and the attitude of a professional to develop and promote thematic areas related to the age-friendly environment, using, of course, all the know-how and the material that the WHO has already, of course, developed in this field, but also, of course, the experience that we have on the ground and the information that somehow we already collected in the very first phase of this project, where we try to identify also in our countries what are the existing good practices. Of course, this workshop will be part of a longer process which will take place in the framework of this European project, which is trying to identify what are the key competencies that are needed for a professional for inclusive aging in age-friendly cities, to define the learning outcomes of this new professional profile, propose and define a training curriculum, and then validate and disseminate it, as we said, also through open source online resources. So just to make you aware of how then your contribution of today will be used by this project and this consortium. After this online consultation in September, we will finalize our proposal for the training curriculum for this professional profile. And then from November to February 2025, the idea is to then develop the content and make it available across the EU through online tools. So this is just to give you a short overview of how we joined forces as a consortium, on what is the aim of this project in general, and what will be the next steps of this project, which will last 29 months and will finish early 2025. But of course, today we want to focus, especially because of your expertise or your area of expertise, on how we can make age-friendly environments where older people are able to fully participate in society as active citizens, as learners, consumers, users, and patients. Just very briefly, I wanted to introduce you a bit the agenda, and then, of course, I would like to give you the floor to all of you for a couple of minutes just to introduce yourself and explain a bit what is your background so that we know each other better. So we will start with this round table, and then I will make a short introduction on the topic just to explain a bit the background we started from for the development of this curriculum. And then we will present you this first draft of the curriculum with its learning outcomes and also learning content to get your feedback and any other suggestions you may have before, of course, making the last wrap up and making some conclusions of the exchange. So if you have any questions, of course, you can use the chat, which will be checked by my colleague Marianna. And then, of course, this is an exchange that you can keep on following with us. There will be also my colleague Sarah, who will speak to you later and will collect further feedback you may have after this online exchange. So this is just a first occasion to have a lively conversation on this topic together. As I said, this content will then be used for the development of the professional profile and also to finalize the learning units of our training that will then be available online through an e-learning platform that will be developed in a later phase of this project. And then all this content will be validated through an international workshops at a national level. So should you have any questions, do not hesitate to interrupt me. If you don't have any questions on the project, I would like to give you the floor to start presenting yourself. I would like to start from the coordinator of this project, Angel from SIOMA.
Hello. Thank you, Alice, for your presentation. It was amazing. Thank you, everyone, for attending this important workshop for the project. I'm the coordinator of the project. I work for the Spanish Confederation of Other People Organizations. For me, it's a pleasure to be here in this workshop, as social participation is for us an important issue, and I think that it is an opportunity to exchange views on these relevant contents that Alice will propose us. I hope that you will find this activity important and relevant, and I just to invite you to participate in the others workshops that are complementary to this, as all the issues are related to one another. It's important for us, the contribution of experts of different cultures, different countries, different expertise. So thank you for coming, and bye for now.
Thank you, Angel. I also wanted to continue with our colleague from the consortium, Willeke, before giving the floor to all our experts.
Thank you, Alice. This is Willeke van Staalduinen from Academy. I'm also the vice chair of Net for AGE-Friendly, where lots of people are present here. So I thank you very much for the cooperation. And also, I hope looking forward to your contributions during this workshop, but also to the other 4. Thank you very much.
Thank you, Willeke. I see now in my screen as a first name, Abdallah Abudaya.
Yeah, thank you. My name is Abdallah Abudaya. Do you hear me?
Yes.
Yeah. I am working as associate professor at VID Specialized University in Norway, here in Oslo. And I have my main focus here today. I have a PhD in public health, actually, from the University of Oslo, and teach mostly on home-based nursing for elderly who's living at home. So my main focus is with the students in the bachelor, master, and PhD level. That's me.
Thank you very much for joining us today. I would like to give the floor now to, sorry for the pronunciation, Daniela Korak-Mandi. Sorry, you are still muted. Sorry.
Sorry. Hello, everyone.
Hello.
My name is Daniela, and I work as a program coordinator at Novi Sad Humanitarian Center, which is in Novi Sad, Serbia. We are an NGO which works a lot with the elderly, not only with them, but we work a lot with them. We provide also home care and help at home for the elderly. We work a lot in providing club services, and recently we've started working on intergenerational cooperation and solidarity promotion. We have also recently started the implementation of a project which is about building age-friendly communities through intergenerational actions. So, therefore, I'm very interested in this topic, which is also quite new for the area where we are working. Thank you.
Perfect. Thank you as well for joining us today. Thank you. We also have Clara de Castillo.
Hi, hello, nice to meet you all. I'm Clara, I'm working for Mensajeros de la Paz in Spain, and I'm also part of this project. And I want to welcome you all to the workshop, and I encourage you to join to the other workshops we have prepared. Thank you very much.
Thank you very much, Clara. I now see Fiola, I think the pronunciation.
Can you hear me?
Yes.
I'm Fiola, I'm from Kosovo. I'm also working on that project for elder person or third age on intergenerational activity. So I'm very interested on learning for this process.
Thank you very much for joining us. I see also our colleague Annie.
Yes, hello everyone. I'm from SOSO Østjylland in Denmark. SOSO is a public vocational educational institution in Denmark, and we provide basic education in the field of social and healthcare, childcare, service assistance in hospitals, and also provide some supplementary training courses for staff. Yeah, so I look forward to talk with you later on.
Thank you, Annie. I see now a SPAR 50 plus.
Yes, hello. My name is Marta. I'm from Poland, from SPAR 50 plus. It's a European Physical Activity Promotion Association 50 plus. We do different projects and for elderly people, for people 50 plus, and it's a very interesting topic and I'm glad that I'm here and I can get to know more about the topic. Thank you.
We too. Thank you. I see my colleague, our colleague Lucia.
Hi everyone, my name is Lucia Thielman. I'm Willeke's colleague from Academy, and I'm looking forward to our discussions later.
Thank you, Lucia. I see Agnieszka.
Yes, hello everyone. I'm working at the Warsaw University of Technology. My background is architecture and I specialize in age-friendly design. And I focus also on its dissemination, and I'm very proud to be part of two important projects, the Hands-on Schaffe and the Big Game, where also the aim was to promote the good solutions for all the people. Thank you.
Thank you for joining us. I now see George Kupik. Sorry for the pronunciation.
Never mind. Hello, I'm George. I come from Serbia. I work for Tara International Consultant. We are currently working on an H+ project. I work as an office assistant and visibility manager, focusing on building age-friendly societies as described and advised by the World Health Organization. And I'm very glad to see you all today and to catch some good advices in this field.
Many thanks for joining. I now see Ilenia, our colleague Ilenia.
Hello, good evening, everyone. My name is Dilan Agano. I am working for AGE Platform Europe, which is an organization of and for people age 50 plus. We are based in Brussels, and we are partner of this project, and we will be looking forward also to meeting some of you in, if not all of you, why not, in our next and last international workshop as announced by Alice. So welcome to meet you all virtually. Have a nice meeting. See you later.
Thank you, Lenia. I now see Dukajin.
Hi to everyone. I know it's difficult to pronounce my name. I'm Dukajin Ishiji from NGO SIRENE in Kosovo. As an NGO, we started a new program. It's quite new approach even for our country. It's AGE+ project, which it's a framework program for social inclusion of elderly people in Kosovo. And yeah, we are also partners with colleagues from NACC and Tara International in Serbia. And project is financed by ODA and implemented by Volkshochschule in Vienna. I'm looking forward to these workshops.
Nice to meet you. Thank you. I see now Hedva.
Hi to all of you. I'm also colleague of the cost of Wilke, some of us here. I'm from Israel. I'm the chair of two departments, Department of Political Science and Department of Public Policy in the Israel Valley College. My research related to this topic is elder care, mainly employees who are combining elder care and paid work. I'm granted by the Israeli National Insurance to learn and to investigate the challenge of those who reconcile or combine work, full work, career, and elder care at the community here in Israel.
Nice to meet you. Thank you.
Thank you.
I also see Dijana.
I'm sorry for the camera. I'm having some troubles. I come from Slovenia, from the Slovenian Federation of Pensioners Associations. I've been working mostly on projects of active aging and how do you say, amateur culture for older people, and on Erasmus Plus projects of adult education.
Thank you for joining. And I see Joanna. You are muted. Yes.
Thank you. Hello, everyone. Well, I'm hardly an expert. I am an architect, and I am together with my partner developing a pilot project that we are now presenting the municipalities, although in a very, very early phase, that concerns aging and aging in place as well. I just also just started my PhD in the same area, so I will probably in the next years have the opportunity to learn a lot. I inscribed myself for this workshop, although probably I will not be able to contribute a lot, but I really think that for my work, I want to know much more about social participation and how I can integrate that into our architectural projects as well, concerning specifically with olding people. So that's why I'm here. Thank you very much.
Thank you too. I now see Florina.
Yes, hello everyone. I'm here today on behalf of Professor Luisa Spiru, who couldn't join the webinar today, but I will say some words about her. She's professor of geriatrics, gerontology, and old age psychiatry at the University of Medicine and Pharmacy Carol Davila Bucharest, and president of the Ana Asta International Foundation. We are an NGO involved in many European projects and networks, and we are involved in research, innovation, and testing technologies for older adults. And I'm happy to join the webinar today.
Thank you very much. I now see Simao.
Hello, everyone. My name is Simão Ferreira. I'm from the Center for Translational Health and Medical Biotechnology Research in Porto, in Portugal. I'm also in the Net for Age Cost, and we have several investigation lines regarding age-friendly development. So it's always good to participate in interesting discussions regarding this topic.
Thank you. Nice to meet you. And now have my colleague Marianna.
Hi, hello to everybody. Nice to meet you all. I am a colleague of Alice and Sara Beccati. I work for ANS, and I am the office manager, and I take care of all the training area for ANS, and I'm happy to join this webinar today. Thank you.
Thank you, Marianna. And now I have Sara.
Nice to meet you. I'm Sara Beccati, and I work for ANS, and I'm engaged on several European projects on aging area, and that's all.
Thank you, Sara. Did I forget anybody? Because sometimes the names are changing in my screen. So if I forget anybody who joined a bit later, do not hesitate to raise your hand. Okay, I think everybody had the chance to speak. So very glad to have this exchange with all of you, and knowing about your background and your experience in this field. I think that considering your background and your areas of expertise, we all agree that older persons have the right to full participation in public, social, and cultural life, as well as in education, continuous learning, and lifelong learning as all other persons, of course. And then, of course, making and supporting older people social participation is also critical for the sustainability of our society. And it's from this belief that we started the development of this project, and also the training curriculum, with a focus on how we can make our communities and cities environments that empower older persons to connect with each other and connect within networks. In particular, in this webinar, we will focus on how we can support older persons as citizens, as learners, consumers, users, and patients. Of course, this is a project which aims to develop a training curriculum, but as we know, many times demographic change is still seen as a challenge more than an opportunity. So, of course, this project also has the general objective to raise awareness on the potential of our aging societies, how we can use this opportunity to make our communities more inclusive and the societies for all ages. And of course, we also aim to facilitate exchanges, cooperations among different professionals. So it's also nice to see that there are different experts with different backgrounds, and discuss together about how we can foster older persons' participation, and then also enhancing their engagement in society as we said, citizens, learners, volunteers, consumers, and users. We start from a situation where we have, according to recent Eurostat data, half of our European countries where less than 50% of older persons are actively engaged in cultural and sporting events. And we also see that there are still many differences between European countries. We see that these discrepancies, and that still less than half of our European countries have more than half of their older population spending at least 3 hours per week on physical activity. So we see that there is still a lot of improvements that are needed to engage older persons in their communities. And we can also see that the percentages are even lower when we are speaking about artistic activities. So we see that never more than 50% of older persons are involved in artistic activities among our European countries. So this is a bit a starting point of our reflection on how a professional could support local actors to engage older persons in the communities. Considering the use of online tools today, we also see that there is still a lot of work that needs to be done to make sure that older persons are benefiting from online opportunities to participate in society. As we see, according to recent Eurostat data, in some countries, in particular women, have never used a computer. So there are still a high percentage of persons in many European countries, at least more than 50%, who haven't used a computer. So we are starting from this situation and this data to also think about what are the key skills, attitude, and what is the knowledge that is needed to make the situation change and facilitate improvements, and also exchanges among European countries to make sure that these percentages are changing in the near future. We also see that if we also look at tourism, still half of the older persons are not participating in tourism for personal purposes. So also in this field, we see a lot of improvements that are needed. And these are just some of the data that we wanted to share with you, just to set the background and to define what is the situation we are starting from for the development of our training module on older persons on social participation. So of course, the idea is how we can make a change to the current situation by defining a set of learning outcomes and training content for a new professional in this field. Of course, building on the existing work of the WHO on age-friendly environments. So how we proceeded in this project, we defined a bit what a professional, in our views, should know, should understand, and should be able to do to support local authorities and local actors in promoting age-friendly cities and communities. In particular, we defined three objectives for the module on social participation. According to us, to our first analysis, following this training, in particular the module on social participation, all participants, all learners should be able to describe what social participation means, first of all. Then a second objective should be to design, develop, implement, and assess social participation projects, programs, and policies. And finally, should be able to build partnership and develop communities to promote age-friendly environments, because as we said, we aim to create more cooperations and networking opportunities also in this field. So this is a first, let's say, aspect where we would like to receive your input. So on these results we would like to reach through this training. So I would like to ask you a first interaction from your side. My colleague Sarah is sharing with you a link to be able to vote and let us know whether you agree with these learning outcomes or whether you would like to include other aspects.
Okay, I have shared with you the link.
Thank you, Sarah.
To the chat.
Thank you, Sarah. So I give you a few seconds to reply. Of course, should you have any questions, do not hesitate to use the chat, and then we will look at the results of the survey. Okay, can you see my screen?
Yes, Alice.
Okay.
Yes.
Okay, for the moment, I see that all participants agree with the proposed results. I still see that some of you haven't replied yet, so I wait for a few seconds. And also, I would like to open the floor while we wait for all replies, in case you have any comments on any other aspects you feel we should add in the list.
I'm sorry, but I have a problem with getting the link.
Sorry?
Did you say I didn't get the link to chat.
You can open the chat.
Pardon?
You can.
Yes, but
you can open the chat.
Yeah, if you open the chat, you see the link that my colleague Sara Beccati shared.
No, I'm afraid I something
If
is not
not,
working.
you can also orally tell me, and we can add your.
Okay, I'm okay with your proposal.
Okay.
Alicia, excuse me.
Yeah.
Someone is asking if the workshop presentation will be available after.
Yes, yes, of course, we will share the presentation and also the recording.
Thank you.
Thank you. Okay, so thank you for your first input. We would like now that we agreed on the results we would like to obtain through this module on social participation, introduce you what are the units that we sought. Of course, we designed this proposal building on the work of WHO in this field, not to in order to not to lose all the expertise and what has been already developed in this area. And we decided to divide the content in four units. First of all, we decided to focus on the supportive environment for social exchange in the community. So to think about how also the built environment, how online platforms, how all this can help the engagement of older persons. The second unit, we decided to focus it on the opportunities that are available for older persons, social participation. We saw in the data before about opportunities to participate in cultural life, in physical life, and learning activities. So we wanted to focus a second unit on all these opportunities and make professionals aware of all the opportunities that are available. Given the importance of lifelong learning, we thought of dedicating a specific unit on this aspect. And then, as we said, since we would like to create cross-sectoral collaboration and multi-stakeholders collaborations, we also thought of dedicating the last unit to multi-level and multi-sectoral interventions. Concerning the first unit, our idea is to enable the learner to create meeting places that are attractive and accessible for older persons, offer older persons with building infrastructures and facilities that support their social interaction. Of course, one focus will also be on the online social participation of older persons, because as we said, there are still many older persons that are not familiar with online platforms and the online opportunities they may have to engage with each other. Of course, an objective that is a bit an objective of all unit is also to use this unit to help professionals detect and prevent loneliness in the local communities through the built environment and online tools. How this unit can how supportive environment can not only encourage the participation but also identify cases where there is the need for support and for older persons and detect loneliness. The second unit, as we said, is more focused on the opportunities that are available. So in this unit, we would like more to develop the learners, let's say, project management skills, like helping the learner design, implement, and assess sociocultural, leisure time, physical, lifelong learning, intergenerational activities and programs. Since we would like to have a multiplier effect also for this project, the idea is also to help the professional design, organize, and assess capacity building activities so that more people can be able to use what we are developing for promoting age-friendly environments. The professional, considering the role we thought about, should, through this unit, be able to provide social counseling and also to coach and motivate individuals and groups of persons to organize and facilitate opportunities for older persons' social participation. So this is what we expect from this second unit. The third unit, as we said, is more focused on the potential of lifelong learning. In this unit, we thought of focusing not only on the knowledge of the learner, not only on the skills, but also on the attitude that a professional like the one we are thinking about should have in order to promote older persons' social participations. And that's why we added to this unit a focus also on the importance to adopt a person-centered approach to social participation, as well as a human rights-based approach to social participation. Through this unit, we would like the learner to be able to also facilitate and support inclusive and collective working, and to design, of course, a plan, implement, and assess lifelong learning activities for older persons. The last unit, as we said, is more for supporting cooperation and mutual learning and cross-sectoral interventions and activities. So the focus of this unit is more on on building a strategic partnership, on facilitating participatory processes, and also facilitating, promoting, and managing multi-level and multi-stakeholders interventions. So this is how we thought about this unit, this module on social participation of our training. And it's here that I would like to receive from you a second feedback to know what you think about our proposal, and then have a starting point for the conversation. So Sarah, again, will share with you the link so that you will be able to reply to our second question. In particular, since we are developing the training, it would be good to know, according to you, what is the most important unit, what is the aspect that you would like more to focus on in the training according to your experience. So I also let you reply to this second question. I'll let you reply still for a few seconds, because the order is changing, so I wait a bit to comment. Okay, I mean, I see that for the moment the order we define is more or less the order you also give to the different topics. Okay, yeah, so I see that actually supportive environments for social exchange in the communities and opportunities for older persons' social participations, let's say, are the two topics that you feel more relevant, of course, for this unit, followed by lifelong learning, and finally multi-level and multi-sectoral interventions. Of course, the floor is also open in case you have any specific comments on these 4 units, and also if you have any suggestions for other units. Now is a time where you can let us know. And of course, at the end also the webinar, you will have the opportunity to reply to our questionnaire should you think about anything else after this exchange. Okay, so many thanks for your interaction and your support in this phase where we are defining the proposal for our training curriculum. So, as I said, we defined 4 units, and we are also now proposing you the content, the learning content of this unit to reach the objectives we identified and I just described. So as for the first unit, we wanted to start with some background information, the context at EU and member state level. We already share with you some data, but of course we would like to give to the professionals more information on the status quo. Of course, we would like to start with a short introduction on what we mean by supportive environment for social exchange in the communities. Of course, we want this training to be operational. So for every unit, we thought of some instruments that can be beneficial for the professional. In particular, in this unit, we would like to help the learner measure the impact of supportive environments for social exchange, and then to have the opportunity to discuss and to brainstorm on a couple of case studies, so that all the knowledge that we provide can then be somehow tested through the analysis of a couple of concrete case studies. And then every unit ends with, of course, some conclusions and some remarks. So this is the plan we thought for the first unit on the supportive environment. The second unit on the opportunities, of course, also wants to start with some data on the context. In particular, I mean, data get old very quickly, of course, but the idea is to provide learners with databases, websites where they can keep themselves updated on the situation, and also be able to elaborate extra data on older persons' social participation. After this part on the context, every unit wants to have an introduction where to describe what are the different opportunities that can be provided. We spoke about cultural activities, physical activities, etc. In terms of instruments, we thought of 2 instruments for this unit. First, a step-by-step guide to social participation initiatives. This instrument aims to help the learner develop the project management skills, let's say, to organize, plan older person social participation initiatives. And the second instrument is also about measuring social participation, so to be able to develop indicators to be able to assess whether people are participating or not in their community. In this unit also we thought about 2 case studies. In this case, we already identified a couple of case studies, one on to combat loneliness, and the second one on the promotion of active senior citizenship. As for the first unit, after the introduction, we decided to focus on 3 aspects linked to lifelong learning. First, how to foster older person's personal development. Second, how to promote also intergenerational exchange and mutual learning, something we also raised in the roundtable as a topic which is relevant for other people, social participation, and how we can prevent the decline in brain capacity. So we would like to make the learner think about these aspects and have some acquire some skills and knowledge on these aspects. Here, instead of thinking of instruments, we decided to focus a bit on the barriers to lifelong learning opportunities for older persons. So to make the learners brainstorm on what could be changed to help older persons become active learners in their communities. And as a case studies, we wanted to focus on the Slovenian third age university as an example of a case to be analyzed. Finally, in the last unit, after the introduction, we wanted to focus on the skills in particular that are needed to set up, develop, and manage multi-stakeholder partnerships. And then we wanted here to provide the learners with examples of multi-level intervention and multi-sectoral interventions. And of course, also to provide some examples of good practices on what can be done. So this is what we thought in terms of content, and for some units, as you said, as you saw, we already identified some good practices, but of course we are here with you to know whether you have other examples that you think should be included in this training. Of course, in this phase, we are also collecting studies on this topic. So it would be great now or during the questionnaire at the end of this webinar to receive any important studies or any important case studies that you know about and we could use both for the case studies, both for the background information that we will provide for the training. So this is what we developed for this specific unit. I wanted to first of all ask you whether you have any questions on what I presented before then going to the last part of the webinar that is dedicated to the discussion. Is there any questions, any remarks? Okay. If not, we would like to use this last part of the webinar to have a last exchange with you. In this case, without links, but simply by just having an exchange through the chat. And of course, if you want to open the floor to check whether now that you also listen to the content of the different unit we developed and so on, whether you feel that we should include other aspects in our learning outcomes, first of all, or if you think that these learning outcomes are already comprehensive enough. Is there any remarks as for the learning outcomes? Okay. Okay, Angel. Angel, the floor is yours. Hello.
Hello. Yes, I would like to comment something about learning outcomes. I read it carefully the other day, and I answered the questionnaire that you sent us for this meeting. And related to the learning outcomes, I would like to make some notes. It consists related to the learning outcomes linked to the Unit 1. I think that I missed the words neighborhoods and rural areas. And I think that it is important, obviously. I think that it will be taken into account when we develop these materials, that neighborhoods are absolutely important for social participation. And rural areas make the difference with urban areas. So it's important to mention it, in my opinion.
Yeah.
And related to the Unit 3 about learning, I would like to emphasize, as it is normal, that digital skills are important, and the gap of digital skills related to older people qualification is important, and I think that we should take it into account. And for the multilateral or multi-level concept that you are referring, I would like to ask you if you are proposing for co-production or co-creation materials, or this kind of participation of the other people, the community or in the city halls, the decision-making bodies. And I think that it is important to clarify a little bit because it's not really easy to identify this concept. But I think that it is linked to this concept of co-creation, co-production. So it's important to listen to the opinion of the older people in the cities and communities, and this is that is opportunity to pay attention on good practice cases or instruments or anything that improve the participation of people.
Thank you. Thank you. As for this last point, we foresaw this part of the training on participatory methods, where I thought of including these aspects on co-creation, co-production of solutions, but we can add a bit more emphasis on this part. And thank you for your comment also on the rural areas aspect on the online participation. We can, of course, especially for the rural area, it's true that we didn't include a specific part of the training on this, and we can add it to the first unit on the supportive environment for sure. And then we can also go deeper on the part on the online participation. So thank you very much for the comments. Do you have other comments, Angel?
No.
Okay, because I see another hand which has been raised. So you can switch on your camera. Yes.
Yes, I have a comment to the Unit 1 supportive environments. In my opinion, it is very important to add some information on dementia-friendly design. I saw that you refer to the universal design, to design for all concepts, and this is very good. But these concepts concentrate on the sensory and physical impairments, and I think that in your learning content there should be also reference to the cognitive impairments because the number of people with dementia will be growing, and too little is being talked about solutions that help people with dementia to live better, more independent lives. And it's not only important for them, but also for their carers who are quite often very well overwhelmed with caring for their relatives with dementia. So the cognitive impairments are here very important in my view.
Thank you very much for this integration that we will add in this part, and for sure will also be dealt through other unit of this training, which will also deal with, of course, how to promote on health issues as well. But I agree that we didn't include this part on the cognitive impairment. Of course, for sure, we will add this part. And actually, since the floor is open, should you have any good practices or also relevant tools, toolkits, or instruments that you feel are very useful in this field, do not hesitate to share them with us so that we add this content also to our training. So thank you for this contribution. Okay, so thank you for your input on the learning outcomes and learning units. Do you have other comments on the learning units before we focus on the good practices? Because of course I would like also to hear from you what are your examples of good practices, considering also your experience. But before doing it, yeah, I wanted to check whether, as for the question 1 and 2, you have other comments that you are yeah, thinking about right now. Okay, if not, I would like to focus this part of the webinar on your example of good practices on social participation, because I heard about your work, your experience, and we would be very glad to hear about case studies or practices that we could include in our training, or that could be inspirational for our training. So for this final phase, I would like to ask you about relevant experiences you would like to share with us, in particular on social participation. Anybody who wants to break the ice? Like I was also, I mean, I know that it's something recent, but I heard about experiences in the field of intergenerational exchanges, for example, which is an aspect that we would like also to include in the training. On this, if you have, for example, projects that you would like to share, it would be great so that we can include your examples.
Perhaps I can start to break the ice.
Yeah,
that is in the age-friendly city of The Hague in the Netherlands. They started the initiative to organize on every corner almost of the city, to organize meeting places. It's called Meeting in The Hague, and it's in nursing homes, it's in community centers, it's in sports areas, etc., where people can easily meet each other and have daily activities. They can meet each other to have questions about how to support with income or with forms, but also to have nice connections with others and doing activities together, to go on an excursion or do knitting and all these activities, or meeting some. So that is also a good experience that I would like to share in The Hague.
Thank you very much, Willeke. And so they meet in the meeting places. I mean, it's a place where they meet simply, or they organize also.
It's a mix. It's a mixture. It's a mixture. It's sometimes run by volunteers, but also by professionals, and they organize things for people themselves. People can also say that they want to have something organized, and it's also for official support by the municipality.
Okay. Okay, so Meeting in The Hague is these good practices from Willeke, and now I see also other two hands that are raised. I see Daniela Korak.
Yes.
Yes.
I wanted to share the example of intergenerational collaboration, so to speak, in the area of helping elderly use new technologies. This is what we organized. This is part of our club activities for the elderly, where we want to actually provide the elderly with the opportunities to also meet members of the younger generations. It's usually students or young adults. And we thought it would be good if we offer them the opportunity to actually learn how to use a smartphone. They are all using it, but they really have difficulties in using all the features of the device. Also, it's quite relevant to help them with using the ATM machines or other new technology, e-banking or else. So we organize small trainings. It's more like a group meetings where a number of younger people helps them individually and in a group to learn how to use these technologies. So that would be one of the examples.
Thank you very much, Daniela, for this relevant examples, also to facilitate the online participation of older persons. I also see the hand raised by Abdallah.
Yeah, actually, I want to share our experience in Norway. For home nursing, we have something we call it dog center or daily center. That means all elderly can go to a daily center where all people are collected together, and they can talk together about their life. They can eat lunch together and get a lot of help about different things. This happens under the normal situation, but under Corona time, it was not possible to do that. So we have used iPad or internet or Zoom, for example, to meet each other in that time. So this is our experience here, and it is sponsored by municipalities or charitable organizations or yeah, something like that. Thank you.
Thank you very much. And was it difficult for participants to switch to Zoom? So how was the impact of moving from physical to online?
Of course, it used to happen with the help of the nurses who are during their activities. You know, usually they have a visit by the nurse 2 to 4 times per day, so they got the help of them that time.
Okay, thank you very much.
Thank you.
Other good practices you would like to share with us, and we could somehow include in this unit on social participation? I also, if not, I also wanted to ask in particular to those who didn't define themselves really experts, but more learners in this, whether among the instruments that we also included in this training, whether you feel that there are other instruments that could be beneficial, we thought of helping the professional have the project management skills to organize social participation activities. We thought of helping the professional be able to measure the impact of social participation activities. But should you think about other instruments we should provide in this training, do not hesitate to also let us know whether you feel we should add other aspects. I'm also thinking at the architect about what we said about the built environment, whether you feel that this unit on supportive environment is sufficient, or whether we could add some extra instruments in terms of built environment, whether there are other aspects we could include.
I just put my start video. As a practitioner, I think one of the most difficult things is making the bridge between ideal and what we can do with what we have. And I think that we need to learn to use the facilities that we already have in order to make them more multifunctional and adaptive. And that's not very easy to learn. I don't think you learn that in school. But also because what I feel in this area is that you really need to also have direct experience with older people, so to understand what would be exactly what you should be looking for or aiming. I'm starting to read a lot, but I think that the direct contact and to understand what are the needs, it's not, you have to be and know people in order to understand how can you adapt the existing built environment, because I would say this is the most difficult or the most the challenge now, because you cannot think that you can build just new buildings. I mean, in Europe at least. So everything should be from the point of view of to adapt what we already have and improve what we already have. And that's, I mean, maybe only the sensibility towards this perspective to transmit this is already important. Or for me, it's like something that I feel.
Yeah, for sure. Yeah, I mean, in this part of the training, we will devote attention to needs analysis, how to make it, how to identify the needs of older persons. But yeah, of course, there is this important element that we could stress in the first unit on the supporting environment for age-friendly cities and communities. So thank you for this extra input. I mean, I think I also see another raised hand from Lucia.
Yeah, I was also maybe adding to what Joanna said. I remember that we did an interview with someone in the earlier stages of this project. And she also said it's very important that professionals who want to promote social participation know how to assess the needs of older people. And she also said that like techniques that are used in interviewing people are sometimes very useful. And she also mentioned this, that she did a training in motivational interviewing, which kind of mixes assessing what people's interests are, what people's needs are, and at the same time trying to motivate them to participate, because sometimes older people also feel that there are a lot of barriers to go to the local neighborhood center or go to the workshops that are offered to older people. So she said that maybe the tool, which is called motivational interviewing, I think I can look it up later as well, might also be useful to put in our learning unit about social participation.
Yeah, good remark. Many thanks, Lucia. Thank you. So, I mean, I think we received further input on the first unit on how to create supportive environments. We will make a bigger focus also on rural areas, on online participation, how we can promote it. We will also add these aspects on how we can use our built environment for the benefits of all ages, so without the need of rebuilding our cities, but how we can also benefit from what we have. We will stress the importance of analyzing the needs also through interviews and different methods. So I think for this first unit, we collected very good inputs. As for the second unit on the activities that can be organized, for sure we will include examples of intergenerational solidarity exchanges like the one mentioned by Daniela, or also the experience from Norway of daily centers. As for the third unit on lifelong learning, do you have concrete examples you feel we could include in our training, ideas on what we could add for in terms of good practices on lifelong learning, like we were thinking about the third age university in Slovenia, but should you have other good practices, of course, they are more than welcome.
I'm always jealous of the third age universities in Eastern Europe. So please include that because in the Netherlands, it's very few. So yeah, it's really nice.
There's one, I think, organization or foundation that gives lectures. I think they're mostly online lectures from students to seniors.
Huh.
I think it's, how would I translate the name? It's like, no, it doesn't translate well into English, but it's at least like students who are doing a bachelor in a specific area that give older adults a lecture about what they're learning in their bachelors. And I think seniors can join these lectures for like a few euros.
Yeah, this is a good example also, so intergenerational exchange and lifelong learning. And yeah, so we can, if you have the link or something, we would be happy to add this one. As for the multi-sectoral, multi-level interventions, also, if you have good practices, it would be great to see how we can, let's say, foster collaborations, because as we said today, we have architects that are motivated to make our built environment more accessible and for older persons. We have person who studied, like who is an expert on dementia. We have different professionals that are active in the field, and sometimes people are working in parallel. So if you have any examples on how we can foster this collaboration, they are more than welcome. Of course, in this unit, we want to provide learners with participatory methods, as we said with Angel, also on how we can co-create and co-design solutions. But of course, any good practice is more than welcome. And a last call in this webinar is that if you have also any references or any studies you are aware about, it would be good that you let us know so that we can include it in once we develop the content of the training. So, I mean, do you have any other inputs on this or yeah, so let me know. If not, I would give the floor to my colleague Sarah, who will tell you about the next steps.
What's exactly? Sorry.
Sarah, we said that about the reporting and the questionnaire.
Okay, that I will send you the questionnaire for the reporting, and Alice, scusami, cioè glielo spedisco?
No, it was just to explain that we will send them a report so that they can provide their input also through email.
Okay. Sorry, yes, I have lost this passage. Okay.
Okay, I think it was a very fruitful exchange. It was good to hear that you agree in principle with all the learning outcomes and the unit we developed, and we will make sure that all the aspects you raised will be added in the training curriculum. And we will keep you also updated on the next steps and once the content will be developed. And we also hope once the training will be available, you will be able also to help us disseminate it and reach even more people through this European project. I see some thank you, Abdallah, for these links that my colleague Sarah is saving so that we include them in the reporting.
Yeah.
Yeah, logistically speaking, we will send you the recording of this webinar and the minutes very shortly. And I hope we will be able to see you in our next exchanges and the next webinar we are having. If there is any other, I see it is the end or still.
Yes, Uncle.
Okay.
Yeah, just to finish this this activity, I would like to mention the a proposal that is started from comes from the European Economic Committee, and it will be defended in the Spanish presidency of the Council, and it's called the European Strategy for Older People. I put a link on the chat, and in this document you can find in the chapter 5 a framework for the social participation in European countries. I think that it is a very interesting document, and I would like to share with you because in this case the social participation is well reflected there. It is a very comprehensive document, and the proposals consider everything that we have been talking about in this area. And it is a good framework to support our training proposals. So that's it, and I think that it's nowadays it's a very important document for all European countries. Also, it's in the national debate, an international debate among governments and authorities at European level. That's it. Nothing more. Thank you for listening, for watching, and that's it.
Thank you, Angel. I take the opportunity to remind you what are our next webinars that we are going to organize. So on the 29th of September on community support, communication information, 21st of September on built environment, 26th of September on social inclusion cooperation, and last webinar on the 29th of September on civic participation and employment. You can register through our website. You will find a link to register, or you can send us an email for registering. So yeah, I take the opportunity to thank you again for all your input, and I hope this is just a starting point for our collaboration in this European project.
Thank you.
Thank you.
Thank you all.
Thank you.
Thank you all.
Thank you very much.
Thank
Bye
you.
all.
Thank
Okay.
you.
Thank you. Bye bye.
Thank you. Bye.
Thank you.